You are welcome back to my YouTube channel. For those joining us for the first time or viewing this channel for the first time, this channel is about the general care of the elderly ones in the comfort of their homes and everything that has to do with the care, infection control, medical emergencies, and so on and so forth. So we'll be starting a series on medical emergencies, but first we'll be going into a very interesting topic as we progress. Alright, so we'll be discussing about infection control. What is infection firstly, and how do we control infectious diseases? Firstly, there are some points to note in caring for the elderly one. Because of their low immunity, they are prone to become infected with variety of infectious diseases. Medically, elderly ones have a low immune system due to their age, and they can easily become infected. We'll be talking about control of infectious disease prior to a series of medical emergencies. What is infectious disease? Before that, we'll be talking about pathogens. So what are pathogens? It is very crucial and important to understand what pathogens are before we can understand what infectious disease really are. Pathogens are microbes or microorganisms that are too tiny to be seen with the naked eye. We can't see them. That is why we have to be very careful when handling foods and any other causes that can naturally cause microbes to gain entrance into our body system rather. Now, what are pathogens? Like I said earlier, they are microorganisms that can be inhaled, ingested in the food that we eat, or find their way into our body system through a series of routes or mode of transmission. Let's take a pause about pathogens. What is infectious disease? Infection or infectious disease are caused when harmful microorganisms or pathogens find their way into our body system, and it can be so serious and life-threatening when it affects the elderly one or those with low immunity. Alright, so what are the signs and symptoms of infectious diseases? Alright, so the first sign and symptom that I will be talking about is hyperthermia. What is hyperthermia? Hyperthermia is a medical term for high body temperature. If somebody is running high body temperature, is an indicator that there is something wrong with the body. The body is telling you that something is going wrong, and instead of treating the symptom, we should treat the root cause of the problem, which is the infectious disease itself, rather than going after just the high body temperature. We have headaches, chills, general body weakness, insomnia, that's lack of sleep, and anorexia, lack of appetite. Other signs and symptoms include headaches, general body weakness, and so on and so forth. How do we prevent infectious disease? As the popular saying that prevention is better than cure. It is better to prevent something than to find a cure for it. So in preventing infectious diseases, we have to make sure that we have a very good hand habit, hand hygiene, washing our hands thoroughly. Hand washing prevents infectious diseases by washing away microbes and germs. Right. Adequate diet also helps in prevention of infectious disease. Adequate diet boosts the immune system. It makes the immunity strong enough to fight all these harmful germs in case it even enters into the system of the body. Another way in which we can prevent the entry of infectious disease or pathogens is by making sure our environment is neat and tidy, making sure that the link in the infection chain is being broken, and eating healthily. So what is this infection chain that I'm talking about? In the next video, we'll be talking about the chain of infection and how infection can be further prevented. So there was a technological mishap, and I have to do a voiceover for the rest of the video. In summary, infectious diseases occur as a result of harmful germs that invade the body of the victims. These germs affect majorly the elderly ones because they are vulnerable to becoming infected easily due to their low or weakened immune system, which is a weakened defense against microbes and germs. The first aid treatment includes tepisponging, which involves the use of a warm and cold water mixed together to massage the body of the victim or the elderly one to reduce the body temperature, and also the use of over-the-counter medicines or analgesics like paracetamol and diclofenac, etc. The prevention of infection is majorly through good hand hygiene, clean environment, and eating healthily. A thorough discussion on the chain of infection will be dissected in the next video. Please stay tuned. Bye for now.